Have you recently been more exhausted than normal, gaining weight regardless of your actions? It's possible that your skin appears lifeless and boring. If so, there's a chance your body is trying to communicate with you. You see, practically every part of your health and well-being is affected by a crucial hormone that is frequently disregarded but flows through your veins. This hormone can cause weight gain, sleep disorders, skin problems, muscular atrophy, and other terrible things when it goes haywire. This has to do with cortisol, the powerful stress hormone that your adrenal glands manufacture. Although cortisol is necessary for controlling blood pressure, metabolism, and the inflammatory response in your body, too much of this hormone can be extremely harmful. What symptoms indicate elevated cortisol levels? The biggest organ in your body, your skin, might be trying to tell you something. In order to help you restore control over your cortisol levels before it's too late, we'll be revealing 8 telltale indicators that your levels are sky high today. First sign: a round, swollen face with a hump that's like a buffalo growing on your shoulders and upper back. High cortisol levels may be the reason of weight gain that occurs suddenly, especially if it's concentrated in the stomach and your arms and legs stay slim. You see, fat is actually redistributed by cortisol, moving from beneath the skin to the face, neck, shoulders, and belly. Therefore, it could be time to have your cortisol levels examined if you've transformed from a trim figure to an inner tube with a bright red moon face. Second sign: skin so thin, it's paper thin and wounded, it rips at the touch of anything, even moist tissue. This occurs as a result of cortisol starting to break down the proteins and collagen that maintain your skin elastic, tight, and thick. The skin's outer and inner layers both atrophy and drastically thin down when cortisol levels are high. The outcome? Visible veins and blood vessels rising through the thinning tissue, tender skin that tears when a bandage is removed, and cuts and bruises that don't appear to heal. If, in spite of your youth, your skin has the papery texture of 100 years old, the cause is probably excessive cortisol. Third sign: unexpected eruption of angry, deep reddish-purple stretch marks across your back, thighs, breast, and tummy. This type of stretch mark is vivid reddish-purple, elevated and roughly 1 centimeter broad, as opposed to the pinkish thin ones linked to the pregnancy or teenage growth spurts. The reason they appear so quickly is that cortisol causes the skin dermis layer to become noticeably thinner and less elastic, which coincides with rapid weight changes. The alterations in your external look are simply too much for the inner layer to handle. You might have a severe cortisol excess on your hands or rather body if the area around your abdomen looks like it was attacked by someone brandishing a bottle of red ink. Fourth sign: Canthosis nigricans is a funky, velvety, black darkening and thickening of skin folds such as the neck, groin, and armpits. You see, Canthosis nigricans occurs when cells on the outer layers of your skin lose their ability to metabolize insulin, in a manner similar to how excessive levels of cortisol can cause insulin resistance in cells throughout your body. Your skin is actually screaming that there is an imbalance in the hormone signals in your body. Therefore, don't ignore if it's your neck or underarms start to appear a little too well brown and leathery. One of the first obvious indicators that you need to control your body's hormonal chaos before serious problems like diabetes arise could be this pigmented velvety thickening. Before we move on to the next fact, if you have enjoyed our video this far, subscribe now and hit the notification bell to get updates about health and wellness. Fifth sign: angry red pimples, blackheads, and whiteheads appearing on your face, neck, chest, and back all at once, accompanied by a beautiful mixture of severe acne. Greetings from the horror that is steroid acne. Contrary to typical acne, which develops gradually as hormones change, steroid acne manifests as a sudden outbreak of cysts that quickly develop into painful, deep cysts, nodules, and extremely painful pimples. It's a full-on assault driven by cortisol, which impairs our skin's ability to fight off acne, causing malassezia yeast that typically lazes around on your skin. Eliminate stressors and control your cortisol levels before your body launches an all-out assault on your greatest organ if you wake up one morning with a face that looks like the ruling council of impulse. Is sudden excessive hair thinning, loss, and growth in some very undesirable regions more upsetting emotionally than physically? As previously stated, cortisol increases the amount of androgenic hormones that circulate, such as testosterone. And what do those accomplish? Cause unpleasant hair growth in inappropriate areas such as your chin, chest, nipples, and abdomen, and induce male pattern baldness in both men and women. Fantastic! Therefore, if you're a lady who, despite normal aging, is suddenly growing thick black whiskers on your chin and you see your main circles the shower drain every day, don't give up on looking at wigs just yet. Your hair's health and growth cycle may be restored by correcting a hormonal imbalance. 7th sign: cuts, scrapes, and wounds that heal slowly. No matter how well you take care of them, never seem to completely heal and stay open to infection. That excellent problem can be attributed to the inflammation-suppressing effects of cortisol. You see, excessive cortisol suppresses inflammation on a long-term basis, whereas acute inflammation produced by your immune system initiates the healing process. Thus, even little bumps or scratches are susceptible to bacteria invasion and reopening before they have a chance to heal. Another indication that your cortisol is stuck in overdrive is if you find yourself frequently needing to reapply bandages and cuts that just won't seal and frequently using antibiotic ointments to prevent infection. If you liked the video, give it a thumbs up and share it with your friends. Let us know in the comments down below. If you ever have noticed something on your neck, you might also want to check out the other videos in your YouTube channel. Just click or tap the videos below here. Thank you for watching.